Doctors at St James's Hospital in Leeds are calling for all babies to be tested for cystic fibrosis at birth. A third of the cases of the disease, which affects the lungs and stomach, aren't picked up until after the child's first birthday, when irreparable damage has already been done.
It's just one little prick, hopefully.
Every newborn baby has a few drops of blood taken from their heel to screen for diseases. Here in Leeds, they use the same test to check for cystic fibrosis, which affects 1 in every 2,500 babies. Cameron's cystic fibrosis was picked up through screening, which meant he was treated long before his lungs could become damaged by infection. It means his chances of living a near normal life are much improved.
Had his condition worsened very early, he would have been in hospital a lot more. The cost would have been a lot more to the NHS. As it stands, it's been picked up early, it's been controlled earlier, and the result is that he's very well at the moment.
Doctors at St James's Hospital also see other children from outside Leeds whose cystic fibrosis wasn't picked up until much later.
We're very sad and angry, and we feel what a missed opportunity to miss a disease which could be treated effectively and remain in good health for decades if picked up at birth, and where damage has been allowed to happen to the lungs, which will undoubtedly compromise survival of the patient in the long term.
The team at St James's compared the survival rates of patients with cystic fibrosis. The average life expectancy is improving, but is still only about 27 years. Of the 37 patients detected through screening at St James's, just 2 have died since testing began 20 years ago. Screening for cystic fibrosis is a lottery entirely dependent on where a baby is born. Apart from here in Leeds, just a few areas routinely test all infants, including Northern Ireland, the Trent region, East Anglia and now Wales. The cost is £1.50 per child. Like all patients, Sunny needs regular physiotherapy to clear mucus from her lungs. She lives just 2 miles outside the Leeds catchment area, which meant she wasn't screened, so her cystic fibrosis wasn't picked up until she was 13 months old, by which time her lungs had been permanently scarred by infection.
I think it's absolutely appalling. Nobody should have to suffer the way my child has suffered, the way that my daughter's illness couldn't be treated, and the way that her illness has taken over her for life now.
A government committee is now examining the evidence from the Leeds programme and will announce next year whether a national screening programme should be brought in.